back. As I said, it's the first of the year and everybody's trying to lose weight. My next guest is here to help us do that, Ms. Chelsea Rust, who is a nurse practitioner with Baptist Health Center for Medical Weight Loss.
Correct.
Did I get all that right?
Yes, you got it.
All right. Now, obesity is more than just being overweight and a cosmetic. There's some real diseases that come with that.
That's correct. Having an unhealthy body weight or body fat mass can increase your risk for a lot of health issues, diabetes, cardiovascular risk, not to mention like arthritis and things people don't think about, just with that carrying that extra weight around is hard on your joints.
Well, I always tell patients, you know, 1 pound of weight off is equivalent to like 4 pounds off your joint. So if you just lose 5 pounds, it's like, you know, 20 pounds off your joint. So it's important.
Correct.
So when you define obesity, is there a number? I mean, how do you know? You look in the mirror, you just don't know you're obese. There's bound to be a way to calculate that. That's
right. There's a lot of different ways. The most common and easy way to measure obesity is using a body mass index, which compares a person's height and weight. So generally speaking, anybody with a BMI over 30 are considered obese. We also look at waist circumference. It's another good measure of obesity, as well as looking at body fat percentage. We have a body composition machine in our office where we can look at a person's body fat percentage because, you know, the BMI doesn't always tell us exactly what we need to know. People who are excessively muscular or like a bodybuilder, they might have a really high BMI, but their body fat percentage is very low. And we have some patients who might have a BMI under 30, but their body fat percentage is in a high risk region where they have a lot more body fat than they should.
Okay, now we get obese by obviously eating and not burning calories, but are there some medical illnesses that can contribute to that?
Oh yes, lots, more than I can list in this short segment. But obesity can be caused by nutrition, but also lack of exercise or lack of physical activity. There's metabolic reasons people become obese. There's psychological reasons. So there's just more reasons than we can count for the reason people can end up having an unhealthy amount of body fat.
But if they come to see you as part of the evaluation, you look for diseases that would affect body weight.
Correct. And then our treatment approach also tries to address all of those reasons. We don't just say, eat a little less, move a little more, the weight will fall off, because that's the approach most people have been told their whole lives. And unfortunately, for most of my patients, that doesn't work. So we look at all of those other risk factors and all of those reasons that led to a person becoming an unhealthy weight so that we can address all of them in order for them to become a healthier person.
Well, give me some examples of that. Somebody comes to see you. How do you help them reach their goals?
So we will look at lab work. We will look at their medical history, other attempts at weight loss. We'll have them do a food journal to kind of see what kind of things they're eating, look at their physical activity, look at a depression screening. We look at kind of the whole person, not just at not just at their BMI, for example. And then we start, every visit, I kind of choose 1 or 2 goals with the patient. What are some small changes, some small measurable changes they can make in the next few weeks or in the next month that can lead to them having a healthier lifestyle? I don't like to look at it as a short-term fix where someone's going to make these really big changes that they're going to do for, you know, a month or 2 months and then go right back to their old lifestyle. I would rather people make some small changes that they can continue that will be sustainable for them.
Now, you're also different. You're the medical versus a surgical.
That's correct.
Explain the difference.
So surgical, people have surgery. We do see some patients who've had surgery. Often, you know, a few years later, some people will have gained back some of their weight, and we'll see those patients if it's been about a year post-surgery. But we focus on non-surgical weight loss. So we use behavior modifications and medications if indicated, some nutritional counseling, exercise counseling, those sorts of things to help people get that weight off.
So it's a combination of everything. It's not just one thing. It's not an operation. It's not a medicine. It's a lifestyle. It's a behavior. That's
correct. We treat the whole person. We take a very holistic approach to treating obesity as a disease process. And we don't just, there's not a one-size-fits-all. As people want it to be this one thing that works for everybody. And surprisingly, we're all biologically a little bit different. So everybody's approach is going to be a little bit different.
It's great information. Thanks for coming in.
You're welcome.
Now here's the Health Talks brought to you by Baptist Health. More on weight loss.
The HMR diet is a highly structured diet. It's very simple. We use meal replacements like shakes and entrees and soups and cereals and bars. So it makes it very simple and you can lose weight very quickly.
The real key to this program is the educators giving us all the information that we need to be successful ongoing for the rest of our lives. And I think it's a lifestyle change that they teach here, and we've never had that part of it before.
So they come into class once a week. They weigh in for accountability. They're expected to keep records of what they're eating and all their exercise. And they have a health coach that they work with. They have midweek support through a midweek check-in with their health educator. We're all here for them whenever they need us.
I've lost a lot of weight through the years, and it soon found me again. So with this program in phase 2, I have support that I go to weekly. I get help from them by recipes and knowing how to eat out and knowing how to cook and things like that. I plan on staying with this program the rest of my life by doing phase 3 and attending once a month meetings to still stay accountable.
Here at Baptist Health Weight Loss, we strive to help our patients change their lifestyles and make healthier choices so they lose weight and then keep it off.